If someone is struggling with IBS, one of the first things I would ever recommend.
Our next guest is here to tell you exactly what you need to know about gut health. Dr Megan Rossi, founder of the Gut Health Doctor, is one of the most influential gut health specialists internationally.
No matter how perfect your diet is, you can't have brilliant gut health. Really exciting in terms of looking at the microbiome and predicting how someone's going to respond to different types of cancer therapies.
Why is our gut health so important?
70% of our immune system lives in the gut. Sleep, exercise, and even stress impact the gut microbiome.
Prebiotics, probiotics. Can we clear up what the difference is?
I'm just going to take a fiber supplement, done. I'm like, I wish it was that easy. This real danger of people really demonizing the ultra-processed foods. This is going to revolutionize clinical practice. Now, Frankie, I'm going to put you on the spot.
Hello everyone and welcome back to Vision of Health, the podcast where I talk to qualified experts about what being healthy really looks like in everyday life. I'm Dr. Frankie Jackson-Spence. I'm a medical doctor specialising in cancer research. My mission is to bridge the gap between science and real life, offering you practical advice to help you improve your lifestyle that is actually backed by the evidence. I'm Dr. Frankie, and this is my Vision of Health. You might have noticed that across the episodes of this podcast, despite having different guests covering different pillars of health, a common theme keeps popping up, and that's gut health. Until fairly recently, the focus of gut health was all about digestion. But now we know that our gut health is linked to many parameters of our wider health, both physical and mental. Our next guest is here to tell you exactly what you need to know about gut health. Dr. Megan Rossi, founder of the Gut Health Doctor, is one of the most influential gut health specialists internationally. Dr. Megan Rossi, welcome to Vision of Health.
It's an absolute pleasure, Frankie.
I have to say, as an academic clinician, I am so excited for you to be on Vision of Health. I just look up to you in a professional sense on so many levels, and I'm so excited to learn all of your knowledge today. So thank you for coming on.
Oh, it's an absolute pleasure, and I love that you're doing a PhD. We can kind of grumble about the ins and outs of PhDs later.
I know. It's there's a lot more to it than I thought when I started. So I'm going to jump straight into the questions because there is so much to ask you. I think gut health has just blown up so much, particularly from when I started medical school. That was over 10 years ago, and it's not something that we were really speaking about. I would love to know how kind of the research behind gut health has changed over your career.
Yeah, I mean, Frankie, that's a brilliant question. And certainly when I was studying nutrition and dietetics like 15 or so years ago, we spoke a little bit about bacteria in the gut and they kind of digested a bit of fiber, but that was it. Like, we didn't really know the ins and outs. And actually, it was kind of the gap in the literature and research that led me to do my PhD, right? So I, after I graduated as a dietitian, was really fortunate to work in two very different environments. One in the clinical setting, so all different types of conditions: kidney disease, heart disease, different cancers. But also, I was the nutritionist for the Australian Olympic synchronized swimming team, and it was really that observation of very different populations, both complaining of the gut, that made me go, God, what is it about this organ, right? Like, so many people are struggling with it. Looked in the literature, 2010, there was a bit of murmurs around all these bacteria doing more than just digesting fiber. That was kind of it. And I thought, you know what, I need to find out more. I'm always being that person who asks the annoying questions, and I want to know the answer. So yeah, I did the PhD essentially looking at whether we target the gut through the right nutrition, whether that could have not just the effects on, gut symptoms that so many people do struggle with, but systemically. Like, can we improve things like our mental health, our heart health, kidney function? And it was really that PhD that was like, wow, moment for me. I was like, this is going to revolutionize clinical practice. And then I knew I wanted to dedicate the rest of my career at that point.
I mean, it's so exciting. And like you've just mentioned, it lends itself to so many different areas. I think we really used to have that kind of narrow mindset that when we spoke about gut health, it was just about kind of like bloating and digestion and are you absorbing nutrients properly? Whereas it's just so interesting that it links to our immune system or our mental health or our sleep or even things like fertility and things like that. So super interesting. I think it's amazing. So can we delve into a few of those things? Why is our gut health so important for our health?
Yeah, look, it really kind of boils down to three areas. And the first one we've known for ages, and that's digestion, right? So no matter how healthy the food you put into your body is, if you don't have good gut lining, then you can't get those nutrients from your gut into your blood to feed things like, your skin, your hair, your brain, etc. So, that's something we've known forever. You need to have good gut health for good digestion. Second one's our immunity. So 70% of our immune system lives in the gut, which I know is no surprise to you. But for a lot of people, they don't necessarily realize that actually, if they want to have a lower risk of cold and flu, nourishing their gut can actually, lower their risk of those sorts of things. So immunity is really key because our gut bacteria and immune system live hand in hand. But really, that third element of those microorganisms, those bacteria, the scientific name, our gut microbiome, that community, it's these guys that are game changing. So they're, doing things that we thought human cells actually did, like helping regulate things like estrogen in our body. We didn't know that the bacteria had a role for that, impacting things like our mental health. Like all of these things, we're now realizing actually these organisms within us are dictating a lot of that. And that's why I think it's a really exciting time.
It's such an exciting time. I was mentioning to you before we started recording that I look at cancer treatments and immunotherapy, and I often have patients who say to me, what should I eat now I've been diagnosed with cancer? And we're really bad at cancer-specific nutrition. Mm-hmm. But one of the things I think about more and more is that if we're trying to harness the immune system, and so much is that is in our gut, it actually does matter what they're eating. And I would love to see more papers come out on kind of different gut microbiome diversity and how that influences response to those therapies.
Yeah, and they've started to do that. In fact, it's really exciting in terms of looking at the microbiome, and predicting how someone's going to respond to different types of cancer therapies. So kind of triaging people. And, for some, and again, obviously it's really complex and you know more than me in the chemo space, but certain types, people seem to, if they've got a more diverse microbiome at baseline, seem to respond better to different therapies. So absolutely, I think the whole world of oncology and our gut microbiome is going to explode in the next couple of years.
Absolutely. And so you mentioned there about how keeping the gut lining healthy is so important and keeping the gut microbiome healthy is so important. Mm-hmm. How do we do that?
Yeah, I mean, one of the key things is diet. So think of these microorganisms in our gut as being completely reliant on what we feed it, right? Mm-hmm. So they need to be fed, just like humans, just like any pets you've got, they need to be fed, right? So the things we're putting into our body, so our diet and nutrition is essentially feeding them and dictates actually which microbes live and which ones really flourish and which ones actually don't do very well at all. So yeah, our diet is so key. Not the only factor, obviously. We know that, sleep, exercise, and even stress independent of what we're eating can also impact our gut microbiome. So, the boring kind of word of, the balance thing. If we're too stressed, not great, not sleeping enough, the 7 to 9 hours, and if we're not moving our body, then no matter how perfect your diet is, you can't have brilliant gut health.
Yeah. And it's frustrating, isn't it? Because if you focus on one thing, but you're right, you neglect those other kind of pillars of your health, it's a little bit of a lost cause. But what I love about that is if you then focus on something like your sleep, it's not just benefiting how you feel the next day, it's also has all these other benefits as well. So any investment in our health, even those small habits, has so many different benefits. And that really highlights that.
100%.
So why are plants important for us? Because most people listening to this will have heard of the 30 plants a week story. Yeah. Tell me about plants. How do plants help our gut?
Yeah, so essentially most of the components of plants, like the dietary fiber, I think a lot of people have heard of that, like the backbone of plants, that's what dietary fiber is, as well as all a lot of people don't necessarily realize because they hear like fiber being so important for their health and they just think, okay, that must obviously be helping, the human cells, and it indirectly does, but essentially it is able to achieve those health benefits via feeding our microbiome, and those microbes then ferment that fiber, produce a range of different beneficial, chemicals like short chain fatty acids. For any other, research nerds listening to this, they'll love, butyrate and things like that, which help not only strengthen that gut lining, but also, nourish the rest of our human cells.
So when people hear the term plant-based, I think what puts a lot of people off is there was this big kind of movement towards veganism. Does being plant-based mean not eating meat, or can you be plant-based and still eat a bit of meat?
Yeah, I love that. These definitions, right? So in my kind of understanding of it, plant-based is your diet is based in plants, but whatever you add on top of that is completely up to you. And that's actually what we see in the literature, right? There is this spectrum of plant-based eating. Like you said, at one end, we've got veganism, 100% plant-based. At the other end, you've got flexitarianism, where, you eat a lot of plants, but actually you might also add in fermented dairy, oily fish and things like that, which we know independent of the other plants, there are some animal products which have associated health benefits for our gut. Not to say you can't have an amazing, gut health if you are vegan, 100% plant-based, which I know, for a lot of people, it's really important for animal cruelty, environmental, cultural reasons and things like that. But actually when it comes to health, human health, the science actually suggests adding in some of these things, animal foods like the oily fish and stuff, is probably going to be ideal.
When you were talking about plants and their benefits and dietary fibre not being absorbed, what are the benefits of fibre? Why do we need to eat more fibre?
Yeah, so it is literally like fertilizer for our gut microbiome. And, when we look back in history, we always knew people who ate more fibre seemed to live longer, be healthier, be happier, all of that sort of stuff. And I guess the why of that we never really understood, because we were like, well, human cells aren't really digesting it. We do know that fiber increases like stool bulk, and maybe it's because people who have better poops, seem to be happier and healthier, and that's why. But I guess the new science is evolving, and now we are appreciating it really comes down to fiber being that fertilizer for our gut microbes. And I think one of the other points of fiber, because certainly in clinic people go, okay, yeah, gut fiber is important. I'm just going to take a fiber supplement. Done. I'm like, I wish it was that easy. But when we talk about fiber, there's just so many different types. It's not just the one type. And that's why, the rationale around the diversity really comes to the forefront, because if you're just having all vegetables as your fiber source, then you're missing out on some of the fibers that are unique to whole grains, for example. So it is important to get that diversity in for the fibers, those different fertilizers.
Yeah, I think diversity really is key, because if you ask most people, everyone's heard of 5 a day, but people seem to eat the same 5 every day. They have like a banana as their morning snack and peas with their evening meal or something like that. And actually, whilst they're eating the plants, they may not be getting the diversity. Talk to me about the kind of 30 plants a week, or as you like to name it, the Super 6.
Yeah, so, this 30 is really blown up, right? But I guess...
Because we love to count.
We love to count. And that's why I do in, like, my clinic, I kind of gamified it by talking about points, right? So we're not just talking about plants anymore, we're talking about plant points. And, giving herbs and spices of a quarter of a point and things so people kind of add them up. But yeah, so there's a number of studies out there which have suggested that eating the more different types of plants is better for your gut health. And kind of as we were alluding to before, each different plant contains different types of not just the microbes that like quinoa and the microbes that like bananas, because each different microbe also has its own skills. So you're going to really narrow down your microbiome and you won't have the resilience and all of these skills that you could potentially get if you really diversified your diet.
If you've lived... Because a lot of people listening to this will be making quite big changes to their diet, but may have been eating in a way that reduces the diversity of their microbiome. If you have reduced your diversity early in life, maybe childhood or, university, when our diets maybe aren't their best, can you rectify that later?
Mostly. Absolutely. We do know the first 3 years of life is actually really important in terms of, really bringing about that diversity in a child's microbiome. But certainly, we've all gone through those stages in uni where, yes, we drank too much, didn't eat much of the gut-loving foods and things like that. But our microbiome is very adaptable, as well as the environment. So we're not just getting these microbes, from our food, playing in the dirt and those sorts of things. Actually, we're getting extra microbes that way. So it's those sorts of elements of not being too overly hygienic. Maybe, if you're going in the tube, definitely use an alcohol gel. But, if you're going, playing in the dirt and stuff, that's actually really beneficial. We don't need to be too hygienic in those sorts of scenarios, because we're getting in extra microbes, as well as heaps floating, like in the forest, for example. We actually inhale microbes via that way.
Wow.
So, yeah, no, it is a really kind of key thing of not just plant diversity, but also diverse environments, we might get some extra microbes in.
That's so interesting. I never thought of that. So what actually counts as a plant? Because everyone just thinks fruit and veg.
Yeah, I know. And I mean, our government guidelines don't really help that, they go for the 2 and 5. And actually, my team at King's is trying to pitch to do the world first kind of clinical trial looking at the number 30, because as I kind of was suggesting, there is some studies, but they're all observational studies, right? So seeing people who eat, the more different types of plants have more diverse range of gut microbes. So we've never really tested out in like a clinical trial. So we need to do that research so we know for sure and the nuances, because I don't think it's going to be a case of like 30 being this magical number. It's just one observation study suggested that. I looked in clinic and actually it's quite achievable for a lot of people. But I think it's not going to be like the cutoff. You just have to get your 30.
Yeah, I think if you get 25, you're doing pretty well.
Yeah, absolutely. But also, why stop at 30? If you start thinking about like teaspoon of mixed seeds, get 3 plant points instead of just the pumpkin seeds. Get your 4 grain mix instead of just your wheat, and those sorts of things. Actually, it's really easy to get well above 30, if not 40 or 50 different types of plants in.
And I think what I love about it is this whole approach is 2 things. We're not talking about calories, which is like a breath of fresh air. And the second thing, it's all about what we add into the diet, like sprinkling herbs and spices. Most people don't realize that they also contribute to your plant intake.
Yeah, 100%. And that's why I kind of use the word the super 6, because people love kind of catchy things. But there is essentially 6 different categories of plant foods. And I think when we are looking at this, getting into 30 plant points, it's quite important to get that diversity across the super 6, because that's another thing I typically saw in clinic when I started to talk about the 30, is that people would be, they might be keto or paleo, and they're cutting out things like your legume group or your whole grain group, and they were like, yeah, I must have brilliant gut health. I'm like, well, actually, there's these 6 categories, and each category delivers different types of fibers and phytochemicals to a microbiome. So we need to be careful if we're cutting out any one of these 6. Now, Frankie, I'm going to put you on the spot. Tell me, what are the super 6? Do you know what they are?
Okay, let me try. So legumes, vegetables, fruits, seeds, herbs.
Yep.
And nuts going to be their own, or nuts go with seeds?
Nuts go with seeds.
Spices?
Herbs and spices go together.
Okay, I've got one more. Whole grains.
Done. And what we find is that a lot of people, particularly in the UK, are just not getting in their legumes.
Yeah.
So chickpeas, butter beans and stuff.
Do you not think it's as well because, like, there's this traditional thing of meat, veg, carb, and people don't see, like, a bean or a lentil as a carb.
Yeah.
It's like potato, bread, pasta, rice.
Yeah.
But actually, all these other things they have a good amount of carbohydrate in. I feel like it's even something that I've had to face an emotional barrier of, that, just because I don't have potatoes on my plate, it's still a complete meal.
Yeah, 100%. I think people are just not brought up thinking about the super 6, and that, is a whole other category in itself. But, tinned legumes is my go-to. They are just so convenient, so cost effective as well. I literally add them to anything, even put some chickpeas on pizza, for example, stir fries, soups, everything. And I think it's an amazing source of prebiotics, which is a certain type of fertilizer which feeds specific types of anti-inflammatory bacteria. So it's a real win there.
So this prebiotics, probiotics, can we clear up what the difference is?
Yeah, 1 letter difference. So I understand why people get very confused, but I actually did my PhD in pre and probiotics, which actually together, another S word, is a symbiotic when you combine them together.
Yeah.
So essentially the prebiotic is like the fertilizers. Most prebiotics are fibers, where essentially they're feeding those specific anti-inflammatory gut bacteria. And then the probiotics. So these are the live microorganisms which have shown to have health benefits attached to them. But I think, when I'm recommending things in clinical practice, very rarely would recommend a prebiotic supplement. I'm generally like, what, if you get your 30 plus plant points, you're going to get enough prebiotics, particularly if they're across the super 6, right? In terms of probiotics, I'm really passionate about this, I think, because I did my PhD in them, and I think they've been really unfairly scrutinized. And the message is just not clear. We're not using them effectively, essentially, because there is actually no scientific evidence out there that suggests if you want general gut health to take a probiotic supplement. But that doesn't mean probiotics are a waste of money. Probiotics are actually indication specific. So we need to start using them like we would different medications and even, certain types of, vitamins and mineral supplements. So like if you have iron deficiency, you don't go and take vitamin D supplement and expect iron to improve because they're different things. The same goes with probiotics. They're indication specific. There's no point just taking any off the shelf and expecting, you to have great gut health. Get your 30 plant points. That's the best way to achieve that. And then use probiotics in indication specific. I think not at the moment, there's not enough evidence, but I think in the future there might be specific types of targeted probiotics, for cancer, different therapies.
Or like, for example, if you take antibiotics and we know that might kill off certain strains, maybe taking a probiotic for those to cover you or something.
Well, in fact, there is actually really good scientific evidence out there that if you have to go on antibiotics and you would take a specific probiotic, and it's called Lactobacillus rhamnosus GG or LGG, and you would take that throughout your antibiotic period and probably for about a week after, and that reduces your risk of antibiotic-associated diarrhea significantly. So that's actually in the guidelines. We've been recommending that. And then thrush as well. There's actually really good for women's health. Good specific type. Colic, another one, and cold and flu. There's also some.
Can I just say, I'm amazed how you just rolled off that bacteria name. Like, it was so easy to say.
Remember, this is what I do in clinic.
I would have definitely stumbled on that. Some of the drugs I give, I have to practice saying them, so patients think I'm competent. So, okay, we're talking about all these ways we can support our gut health. As with anything, is too much of a good thing a bad thing? For example, can you take too many probiotics?
Yeah, absolutely. So taking a probiotic for no particular reason, just off the shelf, actually, it's probably not a good idea. And there is one study, it was quite a small study, but what it showed is they looked at people who had antibiotics, and then after the antibiotics, they just took any kind of probiotic off the shelf. And actually, those who took that probiotic, they seemed to have took their microbiome longer to kind of reestablish back to pre-antibiotic days, because they kind of disrupted it by adding this thing in that it didn't really want.
Yeah.
So again, it comes back to the point of, you shouldn't just take it and think it's going to improve your gut health. You need to be very targeted, like drugs, right? Medications.
And I wonder if there's also an attitude aspect to that, because you think, I popped a probiotic this morning. I don't need to think, I'll reach for some fruit or extra veg at lunch. And I think it's all the behavioural. Sometimes I think when you get into the mindset of taking supplements, it sets you up for the day thinking, okay, I'm doing a little bit of self-care. I'm organised. I've probably got up a bit earlier. But then on the contrary, if you think, I've taken my prebiotic or my probiotic, I don't need to eat those foods.
Yeah, it definitely is a psychological thing, right?
Yeah.
Like for some people, like you said, it's a really good mindset of like, I'm doing this and I'm going to have a really healthy day. But sadly, for the vast majority of people, it's that's covered, tick, and then not even worry. And, if it did help, great. But the fact is there's no science to support that it will help general gut health. So it's like just being cautious there.
And you were talking before about fermented foods and these live bacteria. Can you eat too much fermented foods?
Really good question. So certainly a lot of patients I see in clinic, who've got sensitive tummies, like they've got irritable bowel syndrome, and absolutely they can have too much because they're like, oh, kombucha is so healthy, kimchi is so healthy, and they load up on it. And if you think of fermented foods, they do contain those live extra microbes. They often do contain a lot of fiber and prebiotics, which kind of, gets the microbes really excited. So if your gut's not used to it and you've already got like a underlying kind of gut sensitivity, then absolutely it can kind of create a little bit extra like bloating and maybe even cramping for some people. But what I would say is the gut is amazingly adaptable. Right. And there was a study that came out of Stanford University, and they showed it was a clinical intervention study, and they gave people 6 serves of fermented foods a day, and they showed that in that group they actually had a significant reduction in some inflammatory markers. Now, for a lot of people, they're like, 6, that sounds like loads, right? But it was about teaching their gut, and they didn't just straight get into the 6. I think it was like a 4-week run-in period. So yeah, it's amazing how the gut can be adaptable. But yes, if you go from very little fermented foods to loads, particularly if you've got a sensitive gut to start with, it's not good. You're going to get some extra gut symptoms. Yeah. It won't do damage, I think is probably an important point to say,
just
though.
Feel a bit bloated.
You won't feel great. Yeah, and cramping, which feels horrible, but it's not going to do any permanent damage.
Yeah, that's great advice. So increase gradually if you're going to make some dietary changes off the back of this episode. I'm really glad you touched there about people with IBS, because I mean, I'm not a nutritionist, but I do speak about the benefits of fiber and things for health. And I always get people commenting and asking me, but what about if I have IBS? Because this fiber makes my symptoms worse. Do you have any advice for those people?
Yeah, it's a really tricky place, right? So, a lot of people, I see in clinic, and obviously when you're seeing patients as well, if they've got that sensitivity, they know that these fibers can trigger them, right? So they cut them out, and they think they're helping their gut. But what that actually does, unfortunately, is makes their gut potentially even more sensitive to fiber, reduces down the diversity of the gut microbiome. And we know that IBS is this dysfunction between the gut and the brain. So if your microbes aren't thriving, that can exacerbate and make your IBS worse. So it is really important that you don't restrict fibers for a long period of time. But appreciate you don't want to be having loads of fiber and then having all these symptoms. So it's a case of really teaching your gut to be able to tolerate fiber. And there's certain types of fiber in clinical practice. So I'm sure you would have heard of the low FODMAP diet. And there is really good clinical evidence around that. And what that does is actually reduce down certain types of fiber. So, and most of them actually are prebiotics, so the fibers that feed the good bacteria, right? So you're like, why would you do that? But it's very short in terms of only 4 to 6 weeks of reducing down those beneficial, really active fibers, we call them, in the gut. They produce a lot of extra gas. And then we systematically add them back in and train their gut. So, if someone is struggling with IBS, I think probably one of the first things I would ever recommend, because I see this mistake too many times in clinical practice, is to go to your GP before you touch your diet and get checked for celiac disease.
Yeah.
Because like 500,000 people in the UK are living with undiagnosed celiac disease because they're like, oh, I've just got bloating, I've just got IBS or something. They dismiss it. And as soon as you start tampering with your diet and taking out, wheat and gluten-containing foods, if you get a blood test for celiac disease, it's no longer valid.
Yeah.
You need to have quite a lot of gluten in your diet for it to be valid, right?
But it's interestingly as well that you say that is lots of people self-diagnose gluten intolerance and just cut it out. What is the harm in that?
Yeah, good question. Often because it doesn't really get to the root of the issue and they're still getting some symptoms, and they start to then, okay, well, it's not just the gluten, it must also be the legumes, for example, and they get really narrow diets. We know that narrow diets have a negative impact on our gut microbiome. And then the other thing, actually interesting, there's papers out there published, they compare gluten-containing foods versus gluten-free foods, like the equivalent of whether it's like breads or biscuits and stuff like that. And they've shown not only is it like way more expensive to have gluten-free, but actually they typically on average had less fiber, more fat added. So these other elements of the nutrition of the diet could also be compromised. And you think you're doing good, where actually overall it might not be having a great impact. Of course, people with celiac disease and with non-celiac gluten sensitivity, they of course, need to be very cautious. But cutting gluten out unnecessarily, where you don't really need to, does have negative impacts on the gut microbiome.
Yeah, and I think, I'm about to move on to the topic of ultra-processed foods, but often the gluten-free alternatives contain lots of extra, like, emulsifiers and binders and all these extra additives. And if you don't need to have that, then it's not necessarily the best thing to be doing if you don't have that indication.
Yeah, because we need to remember that gluten is a protein, right? So it's added, it's in foods, has a specific role, like the structure and things. So if that's taken out, we need to replace it with something, and additives is what's being used. So yeah, absolutely.
So social media at the moment, you can't log on without being told to avoid ultra-processed foods.
Dun, dun, dun.
What are the problem with ultra-processed foods? Can you set the facts straight?
Yeah, so I mean, we know that having too many ultra-processed foods is not good for us, right? And it's a case of often they're low in things like the dietary fiber. So if you're having too many of them, essentially you're starving your microbiome, not just of the fibers, but all of these phytochemicals and things that you need. The other thing with ultra-processed foods in terms of like the mechanism is that they essentially have been like a lot of them pre-digested, which means that they're so rapidly absorbed in our intestine that when we're actually eating them, we don't burn as many of the calories that we would normally. So it's called the thermogenic effect of food. So we know that if someone is, having ultra-processed meal versus the whole version, matched for calories, the net gain in calories is much higher when they're having the ultra-processed foods, because actually when you're having the whole foods, you actually burn more of the calories. Now, as we kind of touched on before, we're not fixating on calories at all, but what we certainly do see, people who have more of these ultra-processed foods seem to struggle with their weight for that reason.
Yeah. Well, I suppose if you're getting more calories and less fibre, you're going to be less full for less time. So you can then probably eat more throughout the day as well.
Yeah, and that, it's things like they're so moreish, all of these ultra-processed foods, because they've got the right crunch, they've got the right creaminess, because they've got all these extra additives in it, which actually makes it harder for our brain to go, actually we're quite full.
Do you think the problem with ultra-processed foods then is that they're inherently bad because of what they contain, or because of what they lack?
I love that question. And that is like the ultimate research question that I'm constantly pondering, right? And, historically, I thought it was just all about the lacking, right? They didn't contain those phytochemicals, those fibers, etc., so starve the microbiome. But actually, my team at King's have just wrapped up a clinical trial looking at specific food emulsifiers, which we know, being approved as safe, but that was all before we knew about the gut microbiome. So it was all, really rigorously tested on human cell metabolism, but not the microbiome. So, we've had to retest it, and, we're still number crunching, so I can't share any of the data. But actually, some of the pilot data has suggested from other groups that actually some of these food additives might have a negative direct impact on the gut microbiome. That being said, though, Frankie, I think it's so important to highlight it's going to be dose dependent. Yeah. So having small amounts of them is going to be absolutely fine. Yeah. It's just probably in the absence of fiber, these emulsifiers essentially kind of thinning out our gut lining a little bit with the mucus lining, because that's what they do. They kind of bind in those scenarios. So yeah, I think there is some really interesting research questions going to come out around that. But what I think is this real danger of people really demonizing the ultra-processed foods and saying that they're toxic even in small amounts, because there's no evidence to suggest that at all.
Yeah, I think I agree with you there, that if you have some amongst a wider diet that's rich in all of these other nutrients, fiber, lots of plants, then it's not the same as if your diet is just ultra-processed foods. And actually, I think we can't neglect the fact that for some people, the reality of their diet is eating ultra-processed foods for breakfast, lunch, and dinner every day. And that's where the focus, I think, should be on educating about it, rather than, a person that's eating really well and then goes out for a pizza.
Yeah. And I mean, also what grinds my gears is this whole definition of what actually an ultra-processed food is. True. So, in the scientific world, it's this NOVA classification, which categorizes foods into 4 different categories. And what they do, ultra-processed foods, is so far-reaching. So foods that I would recommend and be like, it's part of a healthy diet, actually they're saying it's ultra-processed and linking it with other foods.
Like what?
So pita bread, right? So, obviously if we could all make our own pita bread at home, great. But actually pita bread, like wholemeal pita bread, I think is generally quite good. Now, obviously you need to check the pack because different brands do different things, but most of the supermarkets pita breads is quite legit. It contains all the ingredients you'd expect to make at home. The yeast, the flour, a little bit of salt, like all of that you would need to make it at home, right? The only additional ingredient which would then classify it under the NOVA system as ultra-processed is a preservative. And the type of preservative known as calcium propanoate, that actually is found naturally in some cheeses.
Yeah, okay.
And it's like a derivative of chemicals that bacteria produce, etc. So actually it's not super scary. And you compare that to actually a lot of the wraps, which I would classify as legitimately ultra-processed, where they've got like 14 different ingredients.
Which I'm so sad about.
Not all wraps. Not all wraps, though. There are some cool brands out there. But sadly, the vast majority have got palm oil added sugars, like many different types of emulsifiers, and refined wheat, such as just gluten on its own. Like so many extra things. You're like, whoa, what is this?
Because most people look at a wrap and think that's healthier than bread.
I know. And but there are some really cool brands coming out now, which shows to have a convenient wrap, you actually don't need to add a lot of that other stuff in there. You can get away with the supermarket shelves not having it. So yeah, I think that's what's frustrating is when they group together all of these foods where it makes it really confusing. So the scientific world, has had this uproar around it. So I think in the years to come, we'll look at reclassifying the nervous system because it's not user friendly.
I actually love what you said there about how, the risk categories may change. Now we know what things do to the gut microbiome, because it really highlights that science changes. We could sit here and have this conversation and in 10 years time there'd be more evidence and some of the things we say are no longer true, and that's what we're working with. And I think people really struggle with that if they're not in the science world, because you can say one thing in 5 years, maybe contradict yourself, but you only work with the evidence we have at the time.
Yeah, it is a really tricky space to be in for that reason. And people are like, oh, you're changing your mind all the time. And I think, a lot of the kind of the nuanced stuff might change to some extent, but also I think the fundamental principles have kind of stayed the same. We do need to eat more plants. We've known that. And yes, now we've added in this concept of diversity, but the fundamental principles have stayed the same. And I think, as researchers, that's why I think, when we are communicating, it's generally, best practice to try wait until there is like a meta-analysis, right? Yeah. So there's a whole body of evidence where we're quite confident. But yeah, absolutely, things change. That's a good point.
So when you were talking then about ultra-processed foods and how the same food may have different calories, I don't really like talking about calories, but I do think it's important because lots of people still live by them. Weight management is such a focus for how people eat. And I really hope that after conversations like this and all the amazing work you're doing so publicly to show people diet is more than that. So much of how we've been taught to eat is to do with weight management. And do you think there is a way people can eat whereby they can maintain a healthy weight without really having to think about it?
100%. I mean, I see it in clinic all the time, and that's just anecdotal evidence. I get that, but there's also been clinical trials, right, where they've shown literally getting people to eat more plants. The goal has nothing to do with weight loss. They just have lost weight and to reach their happy weight by adding these more plants in, reducing down those ultra processed foods.
I would say that's also happened to me.
Yeah, right. Okay.
Like the less I focused on, what the calories are in something and just more on plants, you're just naturally more full, you probably eat less. So that's interesting that you also observed that. Sorry, I interrupted you. Please finish.
No, don't be silly. But like, I love that, you personally experienced it because there is just so many, additional factors that the calories just don't take into account, right? People who are fixated on it, and I understand why, because the world kind of forced them at some stage just to focus on the calories, like on the menus, for example. But like a Kit Kat and banana, yes, it contains like similar calories, but they don't realize, the banana's going to contain the potassium for the heart, the prebiotics to keep the microbiome happy, which then produces different chemicals which help regulate our appetite hormones. So through that mechanism, we actually want to eat less, even though the calories have been matched.
Yeah. It's like so many people are
Yeah, so some really great research from colleagues at King's actually. They showed that like whole almonds, for example, actually provide our body with, I think it's around 20% less calories than what the packet says.
Oh.
And that's because the way that we work out calories in the lab is like to burn them all the way down, extract every last bit of calorie, whereas our digestive system is very different. So the more processing that's done in advance of that typically means the more calories we extract. Which might suggest that things like nut butter versus actually a whole almond might mean that we absorb more of the calories from the nut butter because it's being kind of the cells being broken down.
Interesting. Moving on to fasting. What is the science behind fasting? Because you will hear quite big people in the medical industry rave about the benefits for kind of longevity and life expectancy and things. Do you think fasting has a negative or positive effect on the gut microbiome?
Yeah, a really good question, because you do see on social media, like I've seen some of the headlines, I'm like, oh God, it's a new paper come out? Like I've missed it. Search for it. They're all in animals, right?
Yeah. Or the paper was like 5 years ago and then for some reason the headlines brought it up again.
Yeah, or it's like a study of 5 people.
Yeah.
We know there's so much individual variation when it comes to stuff like that. So what I've taken away from the fasting data is that, yes, we should definitely all be fasting overnight. We shouldn't be waking up at 2 a.m. and then having, a sandwich or something like that. So having, at least 14 hours in the fasted state, we think is beneficial for the gut microbiome. And it helps also clean out our gut. These like little wipers come in and pick up all the little bits. So it is really beneficial for that way. But any extra fasting, we do obviously, again, know that if you've got a smaller eating window, you're going to eat less calories, so you're going to lose weight. We know that. That's one of the obvious benefits that has been shown around fasting. But additional health benefits outside of, the calorie area, I'm yet to see data that has convinced me that actually we should be recommending that. And because I see some of the negative effects of that in clinic, like for example, if people are really reducing down their eating window, it makes it really tricky to get at least their 30 grams of fiber a day. And if you've got gut symptoms on top of that, it's like loads of fiber all at once and you're going to get worse symptoms. And then other things which a few clients have experienced, again, this is anecdotal evidence, but long fasts like these, 24, 36-hour fasts, they find during it, particularly if they've got a sensitive time, they feel great. They feel more energized, interestingly. But as soon as they go back to adding fiber back into their diet, they get horrendous gut symptoms, worse than at baseline, because their gut is no longer able to tolerate it as effectively. And that's some real sentiment. And it sends them into a real negative spiral. They're like, well, I can't eat any plants. And then they kind of go on these no plant diets, which we know in the long term is not going to be good for your health. So I think we need to be quite cautious of that. And some of the animal studies looking at the mechanism that might explain this is that if we're starving these microbes, remember, they're so reliant on us. Like us, they get hangry. And the animal studies have shown that it starts to eat away at that mucus lining, which might suggest our gut's then more permeable. Like the leaky gut concept might allow things to get into our blood system that normally it wouldn't. So there are a lot of cautions there. But again, individual basis, there are some people that I've seen in clinic where actually they do good on a reduced eating window, but just thinking of kind of the cautions around that. So I would never broadly recommend fasting until I see more data to suggest that it's going to have this longevity effect.
I think it's just, if something sounds like too extreme or too good to be true, it probably is. Everything we're saying is actually really simple and boring. And that just doesn't sell because people like some radical new trend to follow, don't they?
Yeah.
Do you think that if you change your way of eating and you eat more plants, that things change where you actually crave less of the kind of man-made ultra-processed food or sugar-rich food, things like that?
Firstly, I've seen it with my husband. So he, NHS GP, knows all the, the stuff, but had a terrible diet, right? And was kind of anti-plants. The first time I gave him some lentils, he was like, what? Anyway, so started to sneak them in his diet. And now, he makes it on his own. I'm not even in the room. And he just craves it.
Yeah.
And then thankfully we've got some clinical, because me as a scientist, obviously there is the anecdote you see from your own life and clinical practice, but I love it when there's a clinical trial that's reinforces this is controlled, this is legit what I'm seeing, and therefore everyone should start doing it. So our clinical trial did show that I think it was after about 6 or so weeks, adding more vegetables to your diet, people's oral microbiome changed, and the taste buds also became more craving of vegetables.
That's so interesting.
So that's why I say to people that, if your family is past the age of being willing to add more plants in, because, teenagers, it can be tough, kids, it can be tough.
Yeah.
Sneak them in, smoothies, a bolognese mince, add some lentils in, they usually can't tell it. And actually over time, they'll start to, be more plant loving and be more appreciative of it.
Yeah, wow, that's amazing. I think it also highlights why people later in life feel it's harder to make dietary changes, because they're more set in a routine of what they eat. And so you, like you said, your taste buds kind of get stuck on something. Yeah. It's never too late to make a change. Your taste buds can change.
They can change. And then also there's data out there that's just, even if you're 60 and you start to make dietary changes, it can significantly increase your life expectancy, your longevity by 8 or so years by adding more plants in. So again, even if you're 60, probably not the podcast sort of demographic, but your parents, they can have, extra healthy life by making those changes now.
And I think that really hits the nail on the head. It's not just about living longer, it's extra healthy life. And that is the same with, staying active or getting more sleep or changing your diet. It is never too late. I have patients that come and they say, well, I've already been diagnosed with cancer now. And I'm like, no, the data shows you can improve your outcomes, quality of life, and how you respond to therapies by making these changes.
Yeah, and I think for me, that's why I've loved the microbiome research so much, because I just find it so empowering.
Yeah.
Because we can't change our genetics. Like, annoying grandma gave me this gene that, increased my risk of breast cancer or whatever it is. But actually the science is showing our microbiome does also really impact our risk of so many different chronic conditions, including certain types of cancers. And we can control mostly our microbiome by how we treat it. Yeah. So I hope people, take away that it's an empowering time for health.
Yeah. And I think as well, speaking of that, people who are looking to conceive, they are creating their child's microbiome in the womb. So actually, it really matters for not just yourself, but for your offspring. And then when they're relying on you for food as well, that is a really empowering focus.
And not to put any more pressure on mums, because it is hard to be pregnant and being nauseated and stuff like that.
Yeah, that's true.
But absolutely, I mean, we see it in the research, the data, right? They show that, what we're eating during pregnancy can impact our kids' kind of taste profile and the foods that they're happy to have and not happy to have. So if you can, again, during pregnancy, it can be so hard. There's so many challenges, but try add a few extra plants in, and you might actually be helping yourself as a parent in the future, because your kids are then more likely to enjoy, these different plants, legumes, garlic, all of that sort of stuff.
Love that. So I'm kind of going to go off on a bit of a tangent, but we've slightly already gone on it. How is our gut health linked to other parameters of health? Like, we just talked about fertility and children's microbiome, but what about our mental health or menopause and things like that?
Yeah, I mean, I could chat about these for hours. So what I find really exciting, particularly like menopause, for example. So we didn't really understand before, but our microbes actually help regulate and recycle estrogen. Wow. So there's this kind of group of microbes called the estrobolome, and these are really important in that recycling of the estrogen. And we think that's probably one of the mechanisms of why we see people who are going through the menopause seem to have, less hot flushes and things and all those other sorts of bothersome symptoms if they add more plants to their diet. So again, it's about empowering. We can't annoyingly help that we go through the menopause. Being female is frustrating for so many reasons, but actually the studies suggest that we could potentially help lower the symptoms to some extent via nourishing the gut microbiome. And that, the gut-brain axis is so fascinating, the stuff that we're learning. And there was a landmark study, you're probably aware of it, called the SMILES trial. And it was done by some colleagues in Australia at the Food and Mood Institute. And what they did is gave me, for the very first time, I think, the permission or the courage to be able to say to patients who are struggling with their mental health that we do have the clinical data that shows that adding these extra plants into your diet, nourishing your microbiome through diet, can have a clinically meaningful difference on your mental health. So I'll talk through just very briefly the clinical trial, because I think it's very powerful. So I had people who had moderate to severe depression. Half of them got this gut boosting diet, very Mediterranean, high fiber, like 50 grams a day of fiber. Wow. Most of us get like 20 grams, right? And they had a control group, which, as you know, as a researcher, is so important to make sure any benefit in the diet group wasn't just because they're seeing the dietitian, right? So they had a befriending type of counselling in the second arm. After the 12 weeks, they both saw the researchers the same number of times. They reassessed their mental health, and those in the diet group, 32% of them had a significant improvement in their depression scores, which would have classified them as no longer clinically depressed. In the control group, that was 8%.
Wow.
Now, I always think it's so important to make the disclosure everyone stayed on the antidepressant medication. So if anyone's listening to this in that position, never go cold turkey and be like, I'm just going to do it all through diet. But see that data as kind of like empowering. So if you are still struggling, looking at your diet can have these additional clinically, meaningful improvements. And certainly my own clinical practice with, the support of prescribing psychiatrists, some patients who wanted to come off antidepressants have by targeting their diet.
It's incredible. And it's so empowering that there's these things that we can do for ourselves. what I'd be really interested to know, sorry if you don't know the answer to this, but in that study, the mechanisms by which it helped improve mood, do you think they would translate to people who don't necessarily have a diagnosis? So just in general, if you're pretty neutral, could eating boost your mood?
I love that because, yes, I absolutely believe that the mechanisms do support that overall it can improve mood. And in fact, there's been kind of follow-on studies that have looked not at as significantly, moderate severe depression diagnosis, but kind of earlier stages. And it has improved, those sorts of markers. And, if we want to get into the mechanisms, this key pathways of our microbes, obviously, when they eat the fiber, they're producing these short chain fatty acids, and that gets into our blood, and some of them are thought to pass that blood brain barrier and have the effect on our brain there. Nice. There's obviously the vagus nerve. Our microbes can tap in if they're happy and doing well, they can tap into that vagus nerve and send signals directly to our brain via that. And then obviously the immune system, right? So 70% in our guts, the microbes can activate the immune system if they sense something is good or bad. That immune system then produces all these inflammatory markers, which can, have an indirect impact on our brain and mental health as well. So
it's incredible. Yeah. I think what's really difficult is for people who are struggling with their mental health is that you often don't want to then cook for yourself.
Yeah,
we end up neglecting these kind of self-care habits when you feel low, like don't exercise or stay up too late, or don't cook for yourself and things like that.
Yeah, I know, and I totally get that. And I think one of the key elements is showing how you can make very simple, tweaks to your diet that's not going to be more expensive, but also more effort.
Yeah.
It's literally whatever you're having for dinner, add a can of mixed beans, get your 4 plant points, whatever's for breakfast, even if it's like a fry up, add a teaspoon of mixed seeds to it, those sorts of things.
Yeah.
So it's not having to, spend hours in the kitchen because, no one is going to want to do that, let alone if you're already, suffering with low mood.
Yeah. And also that I will also say, sometimes I grab on the go and I end up buying a yogurt pot or porridge or something, but then I always buy some fruit to put on it or buy some seeds to put on it as well. You don't have to just accept it for what they've put in the thing.
Yeah, 100%. I'm always about adding in. And, that's the reason why I created Bio&Me, right? Yeah. Convenience on the go that doesn't contain those added sugars and those added things.
Yeah.
Because it's true that we all live busy lives, right? Someone who can't eat conveniently, it's such a barrier for socializing, for work, for all these things. So yeah, it's kind of changing food industry as well. I think it's an important thing.
Incredible. I have just one more question, or two more questions. I lied. I saw a post that you did on Instagram about how gut symptoms may precede a diagnosis of Parkinson's disease. That is mind-blowing.
Yeah.
Can you tell me a bit about that?
Yeah, really interesting. So it was just an observational study. So they took people who had Parkinson's disease and those who didn't, right? And they looked kind of their medical records. Actually, I think it was over 20,000 people with Parkinson's, so a really big cohort of people. And they looked before they got the diagnosis at their prevalence of different gut issues. And what they did show is gastroparesis, so slower emptying of the stomach, as well as constipation. People with Parkinson's who developed Parkinson's had a much higher risk than those who didn't develop Parkinson's. Now, I certainly want to make the disclosure, and certainly did in the post, that if you're suffering with those symptoms, don't think you're definitely going to get Parkinson's, right? But what the exciting element of this is kind of twofold. One is that it might actually then help with early diagnosis. So we might add that to the diagnostic criteria and help, therefore, people get the medications they need earlier to slow progression. But also the ultimate goal will then be looking for a cure. And there is hypotheses out there that suggest that Parkinson's might start in the gut. And that kind of just adds another piece to that puzzle. So loads more research needs to be done. But again, it's we've said it so many times, but it's an exciting time, I think, for research to try understand more of the cause and preventing it via the gut.
And I think this episode has been so important, so fundamental, because I talk about food so much. And I think even on this podcast, we've had multiple kind of nutritionists come on. I think we're really learning that our diet is so much about our health relates to our diet. And it's something that you don't have to completely overhaul. You can make a tiny change. If someone was listening now, what one thing could they do tomorrow that you'd recommend? So
this is going to sound really nerdy, but Frankie, you know that I'm a massive nerd. But every meal that I have, even if it's a snack, I make this priority that there's always something on my plate that my taste buds are going to enjoy, because food should be a pleasure, right? But there's always needs to be something that my microbes are going to enjoy.
I'm the exact same.
So it's like you said, adding something extra. And I think if someone could take one piece of advice, it would be starting to think like that. If you're having a dinner party and you got some friends that are, vegan, you're not going to just serve only meat, right? Because that's so rude. And they're your friends and you want to look after them. Yeah. These microbes, if you look after them, they will look after you back, right? Yeah. They want you to do well. You just have to treat them right. So yeah, that's kind of my nerdy tip for people.
I love it. I take that on board as well. We've come to the end of the episode. I feel like I could speak to you all day. I would love to ask you, what is your vision of health? What does health look like to you?
Oh, that's a good question. What does it look like for me? I think something that's accessible for everyone, I think, is important. No matter what your background is, how much you earn, or your genetics, I want people to feel empowered that they can achieve their own health, because health looks different for different people, right? So yeah, I want it to be something that's accessible, and essentially it's just a joy to live if you're healthy.
Love it. Thank you so much, Dr. Megan Rossi. Really appreciate you coming on the podcast.
Absolute pleasure.
Thank you so much for listening to Vision of Health. I hope you've taken away some practical and realistic health advice that you can implement to improve your lifestyle and get clear on your vision of health. If you've enjoyed this episode, then please do let me know by liking the episode and leaving me a review. If you want to hear more from me, then make sure you're subscribed to the channel. And if you have any friends that could benefit from improving their lifestyle, then make sure you share the episode with them. I'll see you next time.